The Director General of the World Health Organization has said that the world has a long way to walk on the second objective of equitable access to COVID-19 tools across the countries. The Act Accelerator followed the attainment of the fourth objective of the development of vaccine and rollout campaigns under the WHO standard. The CICE has more details of that in this report.
Since the development of the COVID-19 vaccines, the WHO boss has constantly emphasized the need for equitable access of vaccines and tools to low and middle-income countries that have yet to receive a single dosage. Speaking to reporters in Geneva, Dr. Tedros Adhanom Ghebreyesus said the first objective of the ACT Accelerator has been achieved, but there is also a need to work on the second phase, which advocates for equitable access to COVID-19 tools.
The ACT Accelerator was conceived with two aims: the rapid development of vaccines, diagnostics, and therapeutics, and equitable access to those tools. The first objective has been achieved. We now have several safe and effective vaccines to prevent COVID-19. We have rapid diagnostics tests for it. And we have oxygen and dexamethasone to treat it. But we have a long way to go on the second objective. Around the world, people are dying because they're not vaccinated, they're not tested, and they're not treated.
The ACT Accelerator is a new global collaboration to accelerate the development, production, and equitable access to COVID-19 treatments and vaccines. The World Health Governing Body, however, said that the new global collaboration will need $19 billion to promote vaccine distribution.
The ACT Accelerator needs $19 billion this year. That's a drop in the ocean compared with the trillions of dollars governments are spending on supporting their economies and the massive revenues that most vaccine makers are generating. It's not good enough to say that inequity is just the way the world is. It's not okay that people just like you and me die when we have the tools that could save them. We cannot accept the same old story.
Emma Hane, Chief Access Officer at the WHO, said, in order to respond to future pandemics, it will require innovation and to know how tests are developed in countries.
We've seen an expanded scope and need for diagnostic testing deployed in areas like improving public health response, in responding to new variants, and in the future in responding to effective test and treat programs. We're also working to ensure that the ACT Accelerator leaves a legacy. We know that we will need diagnostics to rapidly respond and identify the next pandemic. And to be able to respond to the next pandemic will require innovation in how tests are developed and in how manufacturing is scaled rapidly to ensure we have the tests needed for the global response.
Access to COVID-19 tools. ACT Accelerator is an international campaign that was launched 1 year ago by the World Health Organization and a group of health stakeholders. It is meant to ensure that tools against COVID-19 are developed more quickly and are made available to all countries in a fair way. Reporting for iAfrica News, I am Daisy.
The WHO director encourages for fair access to COVID-19 tools.